Welcome back. You're watching Newslink. Now, every 4.4 seconds, a child or young person between the ages of 5 and 24 dies. That's according to a pair of recently released UN reports that cover the year 2021. Another 1.9 million babies were stillborn during that same period. Joining me now to unpack these worrying reports is Unicef's health advisor for East and Southern Africa, Dr. Paul Ngwakum. Thank you very much for joining us this morning, Doc. Now, one of the reports deals with stillbirths and the other with child mortality. What are the main findings of these two reports, and really just the trends rather that we have seen there?
Yeah, thank you very much and good morning. Thanks for inviting me for this program. As you rightly said, the recent report by the United Nations Group for Estimates of Child Mortality published recently, 5 million children in 2021 died under 5 years of age. And in this report, 2.1 million children between 5 children and adolescents and youth between 5 and 24 years also died. But we also had children who died even before they were born. These are what we call the stillbirths. And this represented 1.9 million children. This basically tells us it would be very difficult for us to achieve the SDG goals. About 54 countries will not be able to achieve the SDG goals for under 5 mortality with this rate. And if you look at neonatal mortality, 60 countries, and for stillbirth, 56 countries will not be able to attain the SDG goals, which is estimated at 12 deaths for 1,000 live births.
So these figures that you have just quoted are very disturbing. And I mean, it's more than 5 million children that have died before their 5th birthday. And that is last year alone. And then a further 2.1 million people between the ages of 5 and 24 years old losing their lives globally. What would you say, Doc, or what do the reports reveal about the main causes for the high numbers that we are seeing of mortality?
You're very right. This is a disturbing report. But despite all the good intentions by governments and also by the different stakeholders in the health sector, I may want to say we still have challenges, especially in Africa, that prevent us and make sure that we are having weak and fragile systems. There are multiple factors, and I think I cannot exhaust them all here. But I think the first problem we are having is that we don't walk the talk. Since 1978, we're talking about primary health care, which simply means we want to ensure that we have preventive, promotional, curative, and rehabilitative interventions as close to the communities as possible that will enable the children to be treated for simple ailments like malaria, pneumonia, and diarrhea, that will ensure that the women have the antenatal care and can be referred to a higher level when they need more specialized care for their delivery. This is not done to scale. This is not done to scale in many of our countries, and even if it is done, there are problems of quality. Just recently, WHO and Unicef published an alarming results of stagnation in immunization coverage and even backslide. Because we are having gaps in immunization, we also having pockets of children which we call the zero-dose communities, and these are pockets that are exposed to vaccine-preventable diseases that might lead to death. And these children don't only have immunization as a problem, they're having other multiple deprivations. They are malnourished, they don't have water, they don't have access to school, they are married off as teenagers, and they have complications for childbirth to themselves and to the newborns that they are dealing with. And other issues are linked to emergencies. We have multiple emergencies, especially in the African region. For example, drought and cyclones that further erode the gains that we've had over the years. The last thing is governments need to put enough resources to be able to finance healthcare delivery, which is not done systematically at the moment.
Yeah, absolutely not. And I mean, as we speak about governments contributing to the healthcare systems in their countries, which would you say are the regions that are most affected by the dire consequences of the state of affairs in a country, particularly in the Eastern and Southern African regions, which is what you focus on primarily?
Well, if I start globally, this report reveals that two regions are most affected, with 80% of the deaths occurring in sub-Saharan Africa and in South Asia. In sub-Saharan Africa, we contribute for like 29% of live births, but we are responsible for over 56% of deaths, which is not acceptable. And if you want to talk about Eastern and Southern Africa, specifically where I am like responsible, we can say 20%, we contribute to 20% of these deaths. There has been some improvement in the last 20 years, whereby there has been like 3.6% kind of reduction. But this compared to places like Europe, we are still like 10 times higher. So I may say we are not on track, and compared to these other regions. And there are some countries that have more problems because of their fragility, because of their more exposure to other natural calamities.
Thank you very much for those insights. That is UNICEF's Health Advisor for Eastern and Southern Africa, Dr. Paul Ngwakum, speaking to us about the dire situation in different parts of the continent and the effects that it's having on child mortality